That's the problem when you're both on radio and on TV. VOP 90.3 FM. Today with me to help on a health discussion is Dr. Igbekoya Olayinka Christopher. He's a pediatrician from Lagos State University Teaching Hospital, Ikeja, Lasuth. Dr. Olayinka Christopher, thank you very much for joining us on VOP 90.3 FM today.
Thank you very much. Thank you for having me.
Okay, so what are we talking about today? I'm handing the mic over to you.
All right, so today we are talking about basically health of children.
Okay.
So safeguarding the health of children. And we are giving the public essential health tips.
Okay.
On how to ensure healthy children in the community.
So of course, this is essential for parents and of course expectant fathers and mothers.
Yeah,
okay,
very
so
true.
Go ahead.
All right, thank you. Well, I'll start by defining health. So the World Health Organization has defined health as a complete state of physical, mental, and social well-being, and not just the mere absence of disease or infirmity. So health should be seen as a key resource, that people need to achieve their goals in life. So, and when it comes to the health of children, it's particularly important because periods of ill health in children can negatively impact on their growth and development, and this can permanently alter their ability to achieve their full potential in life.
Okay.
So we will be talking more about prevention. Like the saying goes, prevention is better than cure. Right. So what do we do? How do we ensure we have a healthy community, healthy children? So in the field of medicine, we usually talk about 5 levels of prevention. And these include the what we call the general health protection. That's one level. We have the third level that is known as early detection and prompt treatment. And then we have the fourth level, limitation of disability. And then finally, rehabilitation.
Okay.
So, but for the purpose of this discussion, we'll be focusing basically on the first 2 levels.
Okay, which
of
is?
Prevention, which is general health promotion.
Okay.
And specific prevention.
Okay.
All right. So, general health promotion talks to the general things that we are meant to do to maintain good health in children. So, and things under this include hygiene, general hygiene, environmental hygiene, and then personal hygiene. Also, we have nutrition, having to take the appropriate diet, and then we also have regular activity, good level of physical activity. For hygiene, a key tool is what we know as hand washing. So hand washing with soap and water.
As simple as that.
Yes.
It is very, very important.
Yes, can prevent most infections. As simple as that. So, and the practice of regular hand washing is encouraged. So people should wash their hands before handling food. They should wash their hands after using the laboratory. People should wash their hands when they just come back home from outside. As simple as that.
Is it the hand washing? Is it like a number of time per day that is appropriate to wash your hands, or it's just only necessary to wash your hands after these different activities?
Yeah, it's more important to wash, at those key, points.
Before eating, after eating, after using the laboratory.
Yes, when you get back from outside, after handling, anything that could be contaminated. Before handling food, then you should, wash your hands with soap and water.
And
Very
of course,
important.
our Lagos Road, especially our transportation system, touched different areas. By the time you get home, you wash the hands.
Yeah.
During the COVID, we were given specific hand washing instructions. Wash your hands
Yes.
30 seconds.
Yeah.
Do they follow the same procedure?
Yes.
Okay.
Yeah. Ideally, you're meant to wash your hand adequately. What we normally ask people to do, you can just sing the happy birthday song
Okay.
while you are washing your hand.
Okay.
By the time you are done singing that, you must have really done a good, thorough job. So you are meant to wash, each fingers, in between the fingers,
Okay.
your wrist, around the thumb, and scrub adequately, and then
Okay.
put on that water.
Okay.
That's good.
Okay.
All right. So I would like to talk about nutrition. Adequate nutrition is very key in development of children and in children's health. There's what we call the first 1,000 days of life in a child. So any deviation in the nutritional status during that period can affect the development of the brain of the child. During that time, there are critical development occurring in the brain. So, and if a child has periods of ill health or undernutrition, then that can limit that child's ability, to achieve their full potential. So key adequate nutrition is important. So, and then we recommend exclusive breastfeeding for the first 6 months of life. Then after that, you can now introduce other things, cereals, and what the family also take. So, and proper balance, proper blend of the nutritional intake is key. Adequate protein, calories, fruits and vegetables, minerals.
Now,
very key.
Let's stick to the exclusive breastfeeding first. When you mean exclusive breastfeeding, what does that mean? No water for the child?
Thank you for that question.
Okay.
Right. So exclusive breastfeeding means feeding the child, that's an infant, the first 6 months, with nothing but breast milk.
Nothing.
No water.
But breast
Apart
milk.
from if a medical practitioner prescribes maybe a medication.
Okay.
That's all. So breast milk only, on demand, as frequently as the child wants. Yes.
So what in a situation where the mother have the inability to properly produce breast milk? What then?
Yes. Thank you for that question. Yes, there are situations where exclusive breastfeeding may not be possible.
Okay.
So if that is the situation, then they can use complementary feeding.
Okay,
with
but
formula.
those are exceptions.
Yes.
Okay.
But most people can actually do exclusive breastfeeding.
Okay.
Yes, with proper counseling, the mother would be able to produce enough milk.
That's usually a very difficult thing to do in this part of the world, where a lot of us started eating about at that third week. You see it every day, where you see mothers start forcing their children to eat normal food after the second, third month. It's a general thing. So how do we sensitize our mothers to let them know that is wrong? Because that's a very difficult thing to do. It's a normal thing in Africa. You hear that in other clients, but in Africa, especially in Nigeria, 1 month, I don't tire a beg, and then you start giving the children rice and eba and amala.
What we can do is to let them know that it's possible, and we have people who are doing it. We have people who are doing it, and the benefit, it's a lot.
What are the benefits?
There's a lot of
maybe
benefits.
that will encourage mothers to do that.
Yeah, there's a lot of benefit with exclusive breastfeeding.
Okay.
The breast milk has a lot of natural protective ingredients in it that can protect the child from diseases.
Okay.
A child that is being exclusively breastfed, number one, there is you don't have to do anything to the milk. It comes naturally, normal, natural temperature, natural taste. The amount of water in it is perfect, and then it has a lot of immune things that protect the child from sicknesses.
Okay.
And then there is no risk of it getting contaminated. So the child cannot start having infections like diarrhea.
I've also heard people said that a child that was breastfed exclusively grow up to become much more brilliant than other children. Is that a myth, or is that a real thing?
That may be correct. As I said, may be correct.
May.
Yeah, but what really happens is that the kind of blend of proteins, amino acids, lipids in the breast milk, they are such that it helps for proper, adequate brain development.
Okay.
And the availability of the nutrients in the breast milk compared to the formula is more.
The formula it's artificial,
yeah,
obviously.
Yeah, it's more in the breast milk. So a child that's exclusively breastfed will bond with the mother more, and that helps, cognitive development.
Okay.
That helps, well-being, social attachment.
Okay.
And then the child will be protected from sicknesses. So and
because
that,
of the high immune system from the breast.
So a child that is healthy, the child will be more healthy. So a more healthy child is more likely to have better cognitive development than a child who has been exposed to infections. So
now, another thing though, what's the process of breastfeeding? Is it the direct breast to the mouth? Or because we also see situations where, like, let's say, working mothers, after a certain time, they store the breast milk in maybe put it in the refrigerator for, where in the absence of the mother, they can breastfeed the baby with that, extracted breast milk from the breast. Is that allowed, or is it strictly it has to be breast to mouth directly for that to work?
So it's allowed.
Okay.
The breast milk can be stored in the refrigerator, can be stored for 24 hours when in the refrigerator.
Okay.
And then you can directly breastfeed the child. So depending on the situation of the mother, right? So if she can directly breastfeed the child, that's the best, because that excludes the risk of contamination.
Okay.
So the risk that you can have with storing it is contamination.
Okay.
So but it can be stored.
Okay. Go ahead. Let's
All
go
right.
to the other nutrients.
Thank you.
now.
So the other, as because of time, I want to talk about the need to monitor the nutritional status of children, so that we can quickly identify those who may be falling short of what they are meant to do, and then we can intervene.
Okay.
So we have what we call growth monitoring, which is actually integrated into the national program of immunization. So usually when children go for their immunization, their growth parameters are measured.
Okay.
So we measure their weight, their height or length, measure their head circumference.
Okay.
So
that head circumference.
Yes, the head circumference shows how well the brain is developing. Yes, so when we use all that to determine whether the child's growth is appropriate or the child is underweight. I also want to state that we are having what we call a double burden of malnutrition in our environment.
Okay.
Yeah, that means we have those who are underweight, who are undernourished, and we're also having those who are overweight
and overnourished. Is there anything like overnourished?
Obese.
Obese.
Yes.
Okay.
So the reason for this is because of the the lifestyle change. I mentioned also one of the things that make for healthy living is activity, physical activity.
Okay.
So what we find now is most people, or most children, even babies, they are already exposed to screen. So and they spend more time with the screen, sitting and just looking at the screen,
phone.
rather than being out there actively playing. So we are now having children who are obese, and that leads to
what about this day and age where we have lots of fast foods?
Yes, that is also one of the problems that we are having. So people should take the locally available foods and make use of those
homemade foods.
Yes, homemade foods.
What about vegetables and fruits? Are there things you can give to children or
yes,
babies?
From 6 months.
From 6
and
months
above, a child can start to be introduced to
that's after
what adults.
That's after they've been weaned off exclusive breastfeeding. You can go normal vegetables and fruits.
But you have to make it
Pasty.
palatable for them. Yes, pasty, such that they can tolerate it.
Okay.
It has to be in puree form.
Easier to digest and swallow.
Yes.
Okay.
It has to be in puree form. You can give them smoothies. You can give them fruits.
That's
Yeah.
interesting. Okay. Now,
All right.
you also talked about immunization.
Yes.
Now, immunization have been a very interestingly controversial topic for discussion the last couple of years. I mean, especially even in the US,
Yes.
you know, we have people that that believe in vaccination,
Yeah.
and we have people that have some
Bias.
what people have called conspiracy theory about vaccination. You
Yeah.
know, so what side of the divide are you on?
All right. Well, I would like to say that vaccines are effective and generally safe ways of preventing diseases.
Lot of diseases.
A lot of diseases.
Okay.
A lot of diseases. And if we look back to the era when, even in our own country, where the uptake of vaccines before the COVID, advent of COVID, you know, we had people, you know, taking more vaccines. You know, and during the COVID pandemic, the lockdown, a lot of people who had
Some
did not have
complications.
access. Yes,
Okay.
did not even have access to
Access.
vaccines, and then it is being said that the COVID virus may have caused some form of alteration in people's response. You know, so now before that period, we have you know, most of these diseases, their incidence or how frequently they occur
Were
has
very
actually
low.
reduced.
Like
Yes.
polio,
Yes,
like measles,
tetanus,
tetanus.
diphtheria. So, but scrolling forward now, we can see that we're having like a resurgence. Some of these diseases, especially diphtheria, in the last few months, we had like quite a number of patients, you know, with diphtheria.
and that was actually when the conspiracy of a vaccine, you know, skyrocketed.
Yeah. So, well, people should realize that yes, you could have very rare side
Complications.
effects from vaccines, but generally speaking, vaccines are safe and they are effective ways of preventing a lot of childhood diseases, and so it should be encouraged.
So, in other words, this situation of vaccine causes this and vaccines causing that is just mischief from
Well,
some.
I don't have the fact to say it's mischief, but
Okay.
the fact is that generally speaking, yes, vaccines are safe.
Okay, so in the situations where they cause some unforeseen complications,
Yes.
what may be the cause
Right.
of those?
Yes, thank you. There's what we know as adverse effects following immunization,
Okay.
right? So, and the most common one is maybe a child having a febrile reaction, which is common, you know, which can happen. So it's not a problem. So that is self-limiting.
Okay.
So people shouldn't.
Just a normal side
Yes,
effect.
people shouldn't be worried when you give vaccine and your child is having fever for maybe a few days, you know, so just a little fuzzy, you know, is a little cranky, you know, that is a general side effect that can happen.
So if that happens, what happens?
So it's like I said, it's self-limiting.
Okay.
Within 24 to 48 hours, it should clear by
Should
itself.
clear. So there's
Sometimes
nothing
you can
extra.
just give analgesics
Okay.
like paracetamol, and then the child will be fine.
Okay.
So, but there are some other effects that could happen, especially maybe the vaccine storage itself has been a problem. Maybe it's been contaminated, and then the child could have an infection from that.
Or the caregiver didn't do a proper job in administering the vaccine. That could happen.
Well, not exactly. Usually, the people who administer the vaccines have some form of training.
Okay.
You know, they are health professionals.
Okay.
Nurses have been trained. Community health extension workers have been trained. So usually they are trained to give those vaccines, and they follow a protocol.
Okay.
So the issues that can occur are what I mentioned. Maybe the storage got contaminated, you know, while transporting it. Different things have happened.
Okay.
Along
So
the way, yeah.
last word as we round up.
All right. Yeah. Thank you. So I would just like to emphasize, you know, adequate nutrition, adequate nutrition. Exclusive breastfeeding is key, and then balanced diet, and then adequate physical activity for children. Let's limit screen time and let the children, be active and play around. And let's make use of the locally available food for children.
Can children do exercise? Are there exercises for children?
Yes, children are naturally more physically active than adults.
Yeah, so, lots of energy.
Yes, so
to burn.
Yeah, if you can limit that screen time, they will run around. That's enough exercise. Running around, jumping, that's enough exercise. But with the older children, adolescents, then we can now have a more structured form of exercise for them. And then finally, immunization, should be adopted. Parents should take advantage of the national program of immunization, visit your health centers, and thankfully these immunizations are free. The government has done a lot, to make sure it's available free. So people should take advantage of that and have their children immunized.
So how do you pediatricians classify children? From what age to what age?
All right. So we have children who are known as neonates.
Okay.
So those are the first 28 days of life.
Okay.
Then we have those who call infants, who are between the first month of life to 12 months of life.
Okay.
And then we have the toddler group. That's from 1 to 3 years.
Okay.
And then we have the preschool age, which is less than 6 years.
Okay.
And then the school age between 6 and 12 years.
Okay.
Then we have adolescents from 12 to 18 years.
So after adolescent is off your hands now.
Yes,
okay.
Adults.
Okay. Thank you very much, Dr. Igbekoya Olayinka Christopher.
Thank you very much
for your time.
Yes, so sorry, just a correction. My name is Igbekoyi.
Oh, Igbekoye. That's what I wrote here. I don't know. I'm getting old. Thank you very much for your time.
Thank you so much for having me.
He's a pediatrician from Lagos State University Teaching Hospital, Lasuth, Ikeja. Again, thank you very much.
Thank you.